what tools you'll use. So again, when we think about birth, we think about pain, yeah? It's the first thing that comes to mind. And the media has done a huge favor to us in showing this scene of like a hospital birth with women screaming and the doctors and nurses like, push, 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 and the woman screaming as she's pushing to get this baby out. I can tell you that is just like complete fiction. Birth really doesn't have to be this way. And in fact, I've never been a part of a birth that I have supported that's ever looked like that. And so pain, how are you going to manage your pain? Now, the tool that I use for myself and the tool that I have trained myself in and then supported other couples to be able to have in a conscious home birth is hypnobirthing. Hypnobirthing for me is the ultimate way to go, because what is it doing? It's doing what I've been talking about. It helps the woman to focus on her breath, her breathing. When we think about pain, when we experience pain, our first reaction is to tense, right? We hold the breath and we tense the muscles. So when the contraction comes, what we will be encouraging the woman to do is to breathe. And the breath is simple. It's in through the nose and it's out through the mouth. Now, this breath in, you allow the stomach to expand. So we know that we're breathing properly, and from the diaphragm, if we just rest our hand onto our stomach and take the breath in, because as you do this, your stomach will inflate with oxygen. And then, as you let the breath out through your mouth, you'll feel that your stomach will contract. Your stomach will contract, it will collapse. Okay, so we'll have a breath together. So place your hand onto your diaphragm. Take a nice deep breath in through the nose. Feel your stomach inflate with oxygen. And then take breath out through the mouth. And feel your stomach as it collapses. And then another breath in through the nose. Feel your stomach expand. And on this breath out, I'd like you to make a nice circle with your mouth. One more time, in through the nose. And out through the mouth. Now, the circular mouth is very important, because if you're creating a circle with your mouth, it means that your jaw is completely relaxing. There's no tension in the jaw. Also, the mouth and the throat is similar to the construct of the cervix and the vagina. And so if your mouth is relaxed and open, your cervix and vagina are relaxed and open also. The science behind the breath. As I said earlier, when you feel pain and you tense, what's happening? You're stopping the breath. That means the oxygen is not going to your muscles in your body. And if it's not going to your muscles, then you're not relaxing because you're tensing, which also means your muscles are in contraction. Now, imagine this process around your baby, because your baby is surrounded by your stomach muscles. So you hold the breath and you tense. You squeeze your baby. You've held the breath, so that means oxygen is not going to your baby. So when the midwife would listen in during a contraction, what she would hear is either an accelerated heart rate from your baby or a decelerated heart rate with your baby. And a pattern of acceleration and deceleration is a sign of what's called fetal distress. Now, if your baby is experiencing distress, what will then happen is your need for an emergency C-section has now become high priority. So, how do we stop that? The breath. Because what's happening is, when you're breathing in this way that I've just shown you, you're relaxing your muscles, right? And because you're relaxing your muscles, you're allowing your body to open. Remember, your baby, it's birthing itself. What you are doing is assisting your baby in the process of birthing his or herself by relaxing your body completely, by breathing and feeding beautiful oxygen to your baby. And in this way, your body is open and allowing your baby to do exactly what your baby needs to do.